57-year-old female here with left shoulder pain for about one day basically. She works out pretty regularly at Orange Theory, been doing that for many years, nothing unusual, but pretty severe pain last night. She took some anti-inflammatory, which helped a little bit. Her exam, she can flex an AB duct maybe to 90. Passively, I can flex her to about 160 with some mild discomfort. She's very tender to touch with the greater tuberosity. She had an x-ray which basically shows, look carefully, you can see basically some calcification just off the greater tuberosity. We're going to go over this patient which had calcific bodies in the subdeltoid bursa. Here we're just looking at a normal subdeltoid bursa overlying much of the rotator cuff. And here you can appreciate these two calcific bodies within the subdeltoid bursa, essentially at the insertion of the supraspinatus tendon and then somewhat overlying the dependent portion of the subdeltoid bursa, going somewhat lateral to the greater tuberosity. And actually in this depiction, the calcific bodies are a little bit medial as compared to what we see here in the actual ultrasound case. 55, I think we can see a little focus of that calcium right here. And here we're looking at this calcium in the overhanging part of the subdeltoid bursa. It almost looks like it's in the tendon, but the tendon does not go over the greater tuberosity where this calcium deposit is. Just overhanging the edge there. The tendon itself looks pretty good. Here we're looking at the supraspinatus tendon. Really not much of a subdeltoid bursitis in this view. Tendon itself looks normal. We'll look at it now in short axis. The left side of the screen is posterior. The biceps tendon on the bottom right corner. So here we got the biceps on the bottom right corner of the screen. Again, normal looking supraspinatus tendon in short axis. And now we reversed it and we got the biceps on the left side of the screen. We can see basic short axis view of the supraspinatus. So you can appreciate a mild subdeltoid bursitis, I believe, in this view. Here's this cross-section view of the superior facet of the greater tuberosity, a nice looking view of that. And now again, we're looking at this tire on a wheel view or short axis view of the supraspinatus tendon. 7 biceps tendon. It's like right over there is where you're mostly tender.
Yeah.
Yeah. Here's 1357. Here we're seeing those calcium spots. So you got biceps tendon and then calcium right there. So here we're pretty much going lateral over that overhanging part of the subdeltoid bursa. We can get a good view of these calcium deposits that I think flared up recently for this patient.